Welcome back to TV5 News at 9. Today we are talking with board-certified neurosurgeon Dr. Jay Jaganathan. Thank you so much for being here today, Doctor.
Good morning, Colette. Thanks for having me.
Good morning, of course. We are talking about sciatica today. So what is that, Doctor?
So the sciatic nerve is formed by the lower three lumbar nerve roots, and irritation of the nerve in general terms can result in a condition called sciatica, which is pain that occurs in the distribution of the nerve itself. And classically speaking, it's pain that radiates from the back, behind the hip, and down to the bottom of the foot. But in some cases, it can have an atypical presentation or atypical symptoms, where the pain may radiate or stay localized to a specific region, such as the SI joint or the back of the hamstrings or the calf or areas like that.
Doctor, what causes that nerve irritation?
There are a variety of causes. Most commonly, it's from degenerative conditions such as osteoarthritis, which pinches the nerves. It can also be caused by conditions such as disc herniations, which can push on the traversing nerve, meaning the nerve that's traveling down the spinal canal, or the exiting nerve, which is the nerve that's coming out at a given level. In rare cases, the nerve may be entrapped outside the spinal canal, and so it can come as a result of conditions where the nerve may get pinched after it leaves the spine as well.
Doctor, how is sciatica diagnosed and then treated?
The diagnosis initially is usually a clinical diagnosis, which means that you see your primary care doctor, they look at your symptoms, and they say this seems to be consistent with a sciatic type of pattern. The definitive diagnosis, especially when you're looking at a cause coming from the spine, is from an MRI scan, which will show the source of the nerve compression. In some cases, imaging of the hips or the other joints might be required. And a lot of times, nerve conduction studies or EMGs are useful as an adjunct tool because they can kind of pinpoint which specific nerve roots are involved and can give some idea of the degree and the chronicity, meaning whether it's a new entrapment or whether it's something that's been going on a long time.
And Doctor, there is minimally invasive surgery for sciatica. Tell us about that surgery.
There are. So, those treatments always start with the non-surgical measures, such as physical therapy and steroid injections. And when these fail, surgery might be used to clean out part of the nerve, particularly when you see evidence of compression on imaging studies. And traditionally, the way it had been done is doing kind of an open, larger incision. But with the advantages of image guidance, and we have an ability now to do more focal incisions, smaller incisions, and really do it with very, very minimal tissue disruption, which means in some cases patients oftentimes can go home even the same day after surgery, and a lot of times can go home after an overnight stay. So the recovery and the postoperative pain usually can be minimized substantially.
Oh, that's great news. So thank you so much for sharing these exciting advancements. Where can someone get more information, Doctor?
They're welcome to visit our website, www.mi-neurosurgery.com, or they can contact our office, including our one in Bay City at 989-701-2538.
Sounds good. Well, thank you for calling in today. We appreciate it. You can find more information on today's topic in the hot link section of WNEM.com.